Hello, good evening, everyone. Shubha Mohalar, Shabaike. Today we are going to start our another session of month-long webinar. And today, instead of Dr. Priyanka coordinating it, I am the one who is presenting. That is Dr. Ruma. Since Dr. Priyanka is a speaker tonight, so I'll request Dr. Priyanka to start her lecture. And before I tell her to start her lecture today, I would like to give a brief introduction to her. And she is not new to anyone. She is a dynamic doctor from college, Paile Shankarpur, Rajiv Gandhi Memorial Ayurvedic College and Hospital, and she is an assistant professor from the Department of Shalya, and we all know her for her dynamic role, and so far what she has been doing for this webinar session is commendable. So I would like to ask Dr. Priyanka to get ready with her presentation. So, Dr. Priyanka, are you ready?
Yes, yes, I'm
So,
ready.
okay, warm welcome again, Dr. Priyanka. Over to you. Good luck with the presentation.
Thank you so much, madam, for your warm invitation. Welcome to all of my respectable teachers, colleagues, students, and all the participants from our institution, out of our institution, and from our states and out of our states, everybody. Okay. And today we are knowing this is very auspicious day. Today is Mahalaya, and today is Vishwakarma Puja also. So we are knowing that this Mahalaya means the actually it is the beginning of the Durga Puja. Better to say the Matrika. Okay, so for that Matri Aradhana. Okay, so I just want to say one thing, that is Ma. I mean Durga Ma is the symbol of all the women in the society. That may be our mother, then a sister, daughter, and even all the women in the society. So whenever we are starting to worship Ma Durga, that time we should remember that we also respect all the women who are residing in our society. We should protect them from any kind of humiliation, any kind of molestation and all. Not only that, we should take care of our mother in their old age, instead of sending them the old home, okay, old age home. So that's why today is very much significant. And not only that, we should worship our Vishwakarma Devata, because he is also the symbol of work. Work means the karma. Karma means actually good work, good karma, okay, and which will in future will give us the fame, fortune, and everything, and our identity also. So that's why it's very important day today. So by the way, so before starting my presentation, I want to give a special thanks to our principal sir, Dr. Tapush Kumar Mandal sir. And because without his inspiration, I could not go that much. And not only that, actually, it is not the one man, webinar. It is the actually teamwork. Okay. So along with principal sir, there is having also the support from the higher authorities. Okay. Not only that, even 3 students are there from the third year. Last day we will introduce those 3 students. They are also continuously helping us, especially the technical part they had handled tremendously. Okay, so that's why I am also very much thankful to them. And definitely today, as the coordinator, I'm so much thankful to Ruma madam also, because she is conducting the entire thing nicely. And another thanks definitely will go to the all the audience, all the participants, because they are also every day they are coming and they are participating and they are making our entire webinar successful. So before starting my presentation, I want to pray our Lord Dhanvantari, and afterwards I'll start. Okay. So a small sloka we are knowing prayer. Just I made myself. The composition is mine. I made it. If any fault would be there, kindly forgive me. Om Namami Dhanvantari Madideva Surasurai Vandito Padupadmam Loke Jada Rok Bhayo Mrittu Nasham Ghatarmisham Vividho Sadhinam Jambu Madhata Bani Bari Bunihi Pancho Prapancha Atmaka Deho Bhajam Santapo Sampat Jara Jarantukam Namami Dhandantari Maditevam Navino Nila Mudikanti Kantam Shantam Haridadashamakha Murtim Purti Shatanam Sumanu Narothanam Namami Dhanvantari Madhidevam Om Shanti Om Shanti Om Shanti. So now, before starting my presentation, I'm just going to give a brief introduction about my topic. Actually, today we are knowing the topic name already, but why I have chosen this topic? Actually, in this present era, each and every human being is having the pseudo wishes and dream. They are having the pseudo wishes and dream to achieve the very much glorious, glamorous, radiant, and flawless beauty. So that's why it has been seen that a minimum 1.4 million cosmetic related and the cosmetic surgery and the plastic surgery related procedures are just performing in the whole worldwide. That may be non-surgical, that may be minimally invasive, that may be entirely so much invasive and all. So that's why today I just dedicated my topic over this, concentrating over this hotcake like topic, that is the clinical cosmetology. So now I'm going to present my, sharing my screen. Is it visible? Dr. Ruma, is it visible?
Yes, visible, visible. You're
Okay.
visible and you're audible as well. So you can start it.
Okay, thank you so much. So I'm Dr. Priyanka Ganguly, Assistant Professor of Shalyatantra Department from Bella Rajiv Gandhi Ayurveda Medical College and Hospital. So today's topic is we are knowing the cosmetology. So what it is actually? Cosmetology is the combinations of the two words, that is the cosmetics and the logi. Logi means definitely we are knowing that is the knowledge, and cosmetics are the actually the biologically very much active substances according to the Drugs and Cosmetics Act that can be poured or rubbed or sprinkled or applied over the body, over the face, just to get what the just enhancing their appearance and just modifying their beauty and all. So then what would be the cosmetology? Cosmetology is the science which is the combinations of the not only the cosmetics along with some procedures by which the people are getting the modified appearance and all. Okay, so now coming to the next one, that is the history of the cosmetology. So in our mythology, we had got several types of, references. So among them, especially, we know that Lord Shiva, when he became so much angry over what the king Daksha, that time he beheaded his head, and that time what happened? Ashwini Kumaras. Definitely, you people are knowing that Ashwini Kumaras was the actually the twin surgeon. They were actually stamped like the plastic or the cosmetic surgeon that time. Okay, and they have again reassembled Daksha's head. But that time what happened? We are knowing any kind of transplantations whenever we are doing that time, this reassemble during this situation, we should see the cells and the tissues are still alive or not. In that case, also same thing happened. That's why he could not assemble his head properly. So he replaced his head along with the goat's head. Okay, though these mythological references we are knowing, but definitely it is one of the first reference we are getting as the the Shiro Shandana. Okay, in the whole world we never ever get this example. Even another next example, that is the warrior woman Vishvala. Okay, so during the battlefield, okay, there during this fighting and all, that time she actually lost her leg, and afterwards this leg was assembled by again Ashwini Kumaras, and by the the prosthetics, that is iron leg. So that was the another first example in our science where the prosthetic already used by the iron leg. Now coming to the next one, that is the ancient history. Yes, in our ancient history, it has been seen in the whole world that usually on 3000 to 2500 BC, first the cosmetic evidence we are getting in Egypt. Okay, so here I am just going to pinpointing. This is the actually 18 Smith papyrus. They are entered the descriptions of the rhinoplasty has been illustrated nicely. Was the next evidence we are getting in 600 BC, Acharya Shusruta. He had explained the entire Nasha Sandhana, rhinoplasty, Karna Sandhana, then Otoplasty, along with the Cilioplasty or the Oroplasty or the Oshtoshandana. Entirely he had explained. Not only that, even he had explained their Anushastra Karma, by which we may also apply for any kind of cosmetic corrections and all. Not only that, even he had explained their Vikrita Apaharana procedures. Vikrita Apaharana means any kind of scar. When the after doing any cosmetic surgery or anything, afterwards what is remaining? Definitely prana or the scar mark is remaining. How to make it normalcy? This normalizations also he had explained nicely there. Okay. Afterwards, here actually 300 BC, Acharya Charaka, he has explained various kind of Barnya therapist, which is actually increasing our Barnya or the complexions and all, along with the Keshia, which is helping to grow our hairs, and so many Sugandhya Drabha. Everything had explained nicely. And afterwards, the 4th century AD, Acharya Bhaghat, he had also explained the rhinoplasty. Not only that, limb attachment, even the using of the grafts, that's also he had explained very nicely. Okay. Now coming to the next one, that is the modern science. Modern science, they also explain nicely that 1st century AD, the Olas Corneocelsus, this actually person, first he was a researcher. He first recorded each and every plastic surgery related procedures. Afterwards, in 1500 AD, Gaspar Tagliacozzi, he successfully performed the rhinoplasty by the using of the flap. Okay. Then next one, that is the 1793, the Francis Chopper. He did the lip augmentations. Okay, he did the lip augmentations by the using of the flap from the from the neck portions. Okay, and this is the very important person, that is the 1917 Sir Harold Gillis. He is also coined as that is the father of modern surgery, because during the First World War, when all the soldiers, they are entirely during this battlefield, entire their figure and their faces became totally disfigured. That time actually Sir Harold again contoured their facial sculpture and all, so that's why he became so much famous after his plastic surgeries and all. So coming to the next one, that is the branches of the cosmetology. Actually, there is having the two type of cosmetology branches. First one is the general cosmetology, another one is the medical cosmetology. Under the general cosmetology, usually the skin care, hair care, skin coloring, hair coloring, pedicure, manicure, each and everything is that there. But always keep in mind that is the general cosmetology is not our section. It is actually handled by the salon experts, okay, in the parlor and all. But medical cosmetology entirely, I mean, concentrated over the plastic surgery, cosmetic surgery, and non-surgical procedures. Okay. Now the next point it is the medical cosmetology. Now the very good question always is coming, that is the plastic surgery and the cosmetic surgery. Both are similar or any differences there? Definitely, both are different. Because plastic surgery is usually it is the one kind of surgical procedure which is constructing, helping to reconstructions or recorrections. Just the example, if anybody is having any deformities, it is actually helping to corrections of the deformities that may be congenital or that may be any kind of traumatic. Okay, but in case of the cosmetic surgery, this is actually what you this is whatever the person is having the attributes. It is actually helping to enhancing these attributes and just modifying their appearance. So that is the actual difference between the plastic surgery and the cosmetic surgery. So under this plastic surgery, there are different surgical procedures are there. So first one, that is the burn surgery. Why it is important? Because it has been seen in case of the first degree burn, it is actually healed up within the 3 weeks, 3 to maximum 4 weeks. But sometimes it has been seen, it is also causing some cosmetic problems. Okay, sometimes it is not getting healed up. So in that cases, the donor part, here we are showing, this is the donor part. From there actually the flap should be harvested over the burn part. So the marking should be done properly. Usually the buttock regions, the thighs regions, we are selecting for the collecting of the flaps. So after cleaning those two areas, harvested areas and the entire the donor part, then this is actually diatom. It's having the blade. By this using this blade, it is actually epidermis layer of the donor part is getting excised out, and this fat should be covered up over the burnt area. And now this is the actually machine which is called the mesh making machine. So artificial mesh should be made up. Why? To just cover up the donor part, because donor parts the epidermis layer are already gone. So we have to again cover up. So after covering, then we have to make just a dressing properly. Okay, so this is also one of the matter. Whenever any burn cases happening, there sometimes these cosmetic issues also may occur. Next one is the craniofacial surgery. Yes, it is also very much common, especially for any kind of cleft palate, cleft lip, like that conditions. There, in case of the first trimester of the pregnant mother, it is very much common. So in that case, it's not only that, any kind of deformities over the jaw, head, skull, neck, and face region, we may go for that also. Traumatic injury, it is very common in case of any road traffic accident, any natural disaster, any sports injury, any falling from height. Most of the cases, any part of the body may affect it. Sometimes the limbs also getting detached or the amputated. In that cases, we are going for some microsurgery. We are using usually the prosthetic materials, like sometimes we are the artificial fingers, artificial ears, okay, even artificial nose. So it is not only helping to for the again cosmetic value, it is also helping for the functional work, doing normal and all. So this is very important. Not only that, artificial inter extremities along with some glue can be attached. Okay, next one is very important, that is the cosmetic surgery. Among them, there are having several types, that is the body contouring, facial contouring, and genitalia contouring. First one is the definitely facial contouring. For that, usually we are doing hair transplantation. It is a big question. Usually we are doing the back portions of the scalp. There is having there is having dense amount of the hairs and all. So in that cases, once again something happened. Once again. If it's not showing, then I have to tell myself only. Okay, no problem. I'm just describing, not such a problem. Actually, hair transplantation, what it is, in case of that, there already I showed the usually from the back side of the scalp, they are having the density of the hairs. Okay, so from there, the layer should be collected, and there would be several, I mean, multiple hair follicles. So that should not be transected. Okay, so enter the bulb along with the follicles should be collected, and then if there is having one follicle or two follicles like that, less follicles, that we should implant in front of our hairlines, because we know in front of our face there is required little bit fine appearances, and the middle portion there is required two or three or the multiple follicles along with this bulbs and all. Okay, so after doing that, then another we may go for, that is the Blepharoplasty. Blepharoplasty, it is also having several importance, because sometimes what happen, whenever brows are getting just sagging down, there is a chances of what, sometimes vision impairment. Not only that, it is also looking the early aging, like that problems may occur. So in that cases, we need to again just repositioning those plasties, repositioning all the brows by the using of the needles. So I don't know why the this one is not working. Let's see if it is working. Yeah, yes, it's working. I think previous slide I am trying to show you once if it is working or not. So no problem, something problem is there. Okay, no problem. Now coming to the eyebrows. So what usually we are doing, just the marking should be done at first. Okay, at the edge of the uh, eyebrows and the middle portions of the eyebrows and the 7 millimeter. Okay, just inside the hairline, there another incision should be given through this one here is showing. So these three areas would be, I mean, suturing along with this needle and all. So it is actually what, it is raising the eyebrows up. So whenever it is occurring, that means this sagginess of the eyebrows getting recorrected. Okay, next one is very important, that is Blepharoplasty. Blepharo means definitely we are knowing. Blepharo means it is eyelid. So same thing also happening when it is also excess amount of the fat or the adipose tissues are getting, I mean, accumulated there. This also, sagging down. It's also looking very aged. Sometimes vision impairment also occurring. That's why by the cautery we are just removing all the adipose, excess amount of the adipose tissues from the upper eyelid. Sometimes if it is Southeast Asian people, for them both of the eyelids also required for this kind of reduction and all. Rhinoplasty, yes, rhinoplasty, definitely it is the nose related problem. Sometimes the DNS people, the deviated nasal septum, those kind of people are also having some functional problem. That time also rhinoplasty we are doing. Not only that, for cosmetic purpose also. Here we may see that after giving the incision, this is the septal cartilage, we just removing out, and afterwards by the using of the surgical hammer, we again reshaping the entire the bony harm, because it is actually causing the what, the broadness of our nose. So this is actually tip work. Again this already aside this septal cartilage, we are kept over the tip areas of the nose, just to make our nose little bit sharp, little bit more attractive and all. So this kind of rhinoplasty is also very much applicable for functional and for the cosmetic purpose also. Next one also the rachidectomy. It is actually what, it is actually facelifting. Okay, in modern sense we are telling, and it is actually combinations of the cheek augmentation and neck lift. Cheek augmentation means usually some people are having what, very shrunken, I mean, day by the becoming aged. Sometimes they this cheek portion becoming very much shrink, very much asymmetrical. Okay, so then we have to implant some silicon implantation and all. So how we are doing usually through these summer regions, we are making the pocket, okay, by the using of the cautery. And after making this pocket, then based on the patient's their choice and all, based on that we are implanting this silicone implantations, okay. So afterwards, actually, this is very much common in case of not only aged persons, even the person who is suffering from malnutrition for a long, for them also it is becoming a big problem. Next one is the neck lift. Yes, the another aging sign, that is the neck lift. It has been seen that excess amount of the fat, excess amount of the skin suddenly getting sagging, okay, and vertical muscle band, horizontal skin creases. Those are the all features which is making our neck portion very unattractive. For that, we have to go for any vertical. Here also in the videos we are showing that is, it is a vertical band. This is also, we have to first the muscular entire excision we should be done. Afterward, the excess amount of the sagging skin should be again removing, and afterwards it should be closed. The edge of the skin should be closed properly. Okay. In case of the chin augmentation, mentoplasty and genoplasty, the two type of processes are there. Some people are having very heavy chin. That's why they are looking very unattractive. And someone is having very much it is very much depressed type of. There is required of any implantation when it is very much depressed and all. So in that cases, we are also using the implant, and for the fixation is required. Otherwise, after giving this incision in the 2 millimeter, like that, just below the chin portions, and whenever we are introducing this implantation, then what happens, sometimes if it is not getting fixed, there is a chances of the mobility. So that's why 8 millimeter, 8 or 4 or 2 numbers of this screw we are fixing along with that. Next one is the lip augmentation. Yes, some people are having the choices to make it fuller. Okay, so for that, they usually by the using of the scissor, first we have to make one canal or the tunnel inside the lips, and through that the usually the implantation should be done. This silicone implant, it is usually we are introducing by the choice of the patient. That may be 2 millimeter, 4 millimeter, 5 millimeter, 8 millimeter, based on their choice. And afterwards, the both of the the edge of the lips should be closed or sutured properly. For the otoplasty, it is also another thing, that is for the anti-helix portion. Some people are having it is very larger. It's looking just like the vampire-like ear. So for them, the excess amount of the fats and the cartilages would be removing out from the anti-helix portion, because it has been seen the person who's actually this helix and the skull, there is having such of angle, that is 21 to 30-degree angle. It is actually normal angle. So if it is looking, if it is like that, means it's look normal. But usually it is more than that, means from behind it's looking just like the hockey stick, and just like the just like the vampire ear like. Let's come into the next one, that is the body contouring cosmetic surgery. Yeah, liposuction. Lipo means we are knowing that is the.
Sorry to interrupt you, Dr. Priyanka. I would request everyone to mute their audio as well as mute the video, because it's distracting for the speaker who is saying. It will be beneficial and helpful for the speaker who is speaking. Just thank you so much. Please continue, Dr. Priyanka.
Okay, thank you. So now coming to the liposuction, there we had seen the lipo means the lipid, and suction means the by the suction machines. Whenever we are just all the lipid portions we are just removing out from the body. Usually it is applicable for abdomen, buttocks regions, thighs and all. So here actually tumescent, it is one kind of anesthetic agent. It should be first introduced through small incision, and then the canal should be introduced, which is actually collecting the fats or the lipo, okay, from or the lipid from the accumulated areas, and after accumulations of the fluid, then it should be collected in the jars, okay, and afterwards this small incision should be closed by the suture and all, okay. So next one is the brachioplasty. Yes, for some people it has been seen that for especially the girls, it has been seen after some age their fat accumulation is occurring just armpit, arms and the elbow areas and all. So it is actually for that we have to first mark it properly, and then by the cauterizations we have to remove the excess amount of the adipose tissues and the excess amount of the skin, and both of the skin afterwards should be uh, again closed or sutured properly. Okay. Next one also very common for girls also, for men, but for girls it's much more common. That is the thigh. Thigh, there also sometimes excess amount of the fat is getting stuck. For that, the liposuction usually we may do. Okay, after collections of the fat, then we have to usually we have to give the incision before after making this marking properly to the anterior and the medial portion of the thigh, and the excess amount of the thigh, adipose tissues, fats, and the skin, everything will be removing out, and afterwards the both of the skin should be sutured properly. Okay. Next one is the abdominoplasty. Yes, whenever the excess amount of the fats is getting stuck over the abdomen, it should be removing. So sometimes it is taking 1 to 5 hours, sometimes it is taking 1 to 3 hours, depending upon that. So after just doing the liposuction, then just initially by the using of the cautery, the anterior iliac fossa. So both of the anterior iliac fossa, the one incision should be given, and then the entire abdominal flap should be just elevated. And this is actually what you know. This is actually belly button. Belly button should be restored. That's why here we are just making it. The surrounding area we are restoring, and now it is actually temporary stapling we are doing, because afterwards again we will mark properly how much tissues, how much excess amount of fat we have to removing out, and afterwards this is the new area. Through that again belly button should be set up, and then as a last actually this is the finishing touch. Again we have to do the liposuction, and afterwards finally we have to close the suture properly. Now, bariatric surgery also very important. This is also what you know. It is actually helping to reduce the capacity of the stomach. Okay. Not only that, it is also helping if the person is having the tendency to have the food 4 glasses. It is actually helping to reduce the size of the stomach. So it's only hold the 1 cup of food. So like for that only the bariatric surgery we are doing. So what we know, what we are doing actually by the using of the laparoscopy, usually we are first cutting the we are making the stomach to the small size, and this is actually small intestine. We are also making it to half, and then we are anastomosed the small portions of the stomach along with this small intestine. Okay. Not only that, even sometimes the window also we made up just above the stomach, and again another band, adhesive type of band, we are just making it close. So what happened? It is becoming so much narrow, so very narrow place. Through that very less amount of food can go through that. Okay, so that's why people are having what you know, people are having less tendency to have the food, and also only after having 1 cup of food they are feeling full of abdomen. They are feeling, oh no, I'm not having that much hungriness and all, because already there is having narrow places, so food could not be hold there properly. So next one is the wart, mole and scar removal. For that it is also very easy procedure, so a very common factor day by day it is occurring. So usually what happening surrounding the mole or the wart or any scar, usually first we are giving the anesthetic agents, any injections like that, lignocaine or xylocaine, whatever, 2%. Afterwards, the entire mole or the scar should be removing out. If there is having the tendency of the excess amount of the bleeding, that time we go for any cauterization. Otherwise, we are actually for the facial purpose or face related any this kind of wart and mole, we are trying to avoid any kind of cauterization. If there is having bleeding, only we may go for that. Female genitalia and the male genitalia. Yes, the breast augmentation, labioplasty, hymenoplasty, this is under the female genitalia contouring. And for the male genital contouring is there the gynecomastia and phalloplasty. What are those? I just tell afterwards. For first one is the breast augmentation. What you know, for some people who are just undergoing for mastectomy for the CA patient, and they are very much young. For them, sometimes the implantation is required. Okay, so in that cases, usually the anesthetic agent should be given to the pectoralis major areas and the subpectoral regions. There, one incision, usually 4 mm incision, should be given, and through this pectoralis major, one small pocket should be made up. Okay, and through that, if it's required any bleeding, much more bleeding is there, then cauterization is required to cease the bleeding, and afterwards the antibiotic irrigation should be given, and then through this pocket again 450 cc like that silicone gel implantation should be inserted. Okay, and their size also, it is actually depending upon the choice of the patient entirely. Now the another one is that sometimes some people are having the sagginess. Okay, for that also mastoplasty also we are doing. There one small incision is given, and the entire nipple should be again just repositioning above to make it little bit just sagginess would be recorrected. Okay, another one I'm just going to tell, that is the labioplasty. What is the labioplasty? I'm just going to here labioplasty. Sometimes the lady the woman is having the excess large amount, large sized uh, major and all. So for that we have to removing the excess amount of the labius major and all. In case of the hymenorrhaphy, usually what happened during any sports, during any traumatic injuries and all, sometimes hymens are getting entirely rupture. So for that also hymenorrhaphy is another surgical procedures are there. I have not put those pictures. I'm having the videos along with me, but for the privacy, for the nudity purpose, I just avoid those all videos. Okay, I just remove them all. Now next one is the for the male person, their gynecomastia is that this is nothing, just the excess amount of the fat or adipose tissues whenever it is getting accumulated over the chest region. This is actually having very much cautious. The people should be cautious about this matter, because sometimes it has been seen there is a relation between the in future any cancer and all. So that's why it's always recommended that if excess amount of the adipose tissues are getting accumulated over this chest area for the male, they should remove it out. The same procedures by the removing the excess this adipose tissues along with the liposuction also followed by. Next one is the phalloplasty. Phalloplasty also, it is what you know, some people okay having some congenital problems. Okay, since they are birth they are having small penis and all. Not only that, during any road traffic accident, okay, sometimes the pelvic region has been totally macerated. There is a chances of the totally loss of penis and all. Not only that, even transgender person, they are also having the loss of their enter the penis and all. For them also sometimes the silicone based implantation would be done by the choice of the patients, their choice actually depending upon their size and all everything. So next one we are coming to the next, that is the non-surgical or minimally invasive procedures. There is having several kind of procedures, okay, for the specific coverages, that is the full body coverages and all several. So first one, that is mesotherapy. Yeah, so it has been seen some male pattern baldness. Okay, someone having the due to the hormone imbalance, they are having the baldness. For them some vitamins and some minerals and should be injected over there. This is actually the non-surgical procedures. For the dermal fillers also, this is also non-surgical. Usually the fat injections, usually the collagen, it should be injected through the what you know the through the lips, through the cheek portions and all, wherever having some shrinken type of nutrition people, okay, who is having very much asymmetric facial contour. For them, usually dermal filler is very much effective. Okay. Next one is the botulinum toxin. It is actually what you know the protein, the bacterial protein, which is causing the paralysis over the muscles and all. So that's why whenever it is applying over the orbital regions and the temporal regions and also there the fine lines or the wrinkles, they are also could not be seen properly. Why? Because the muscle is getting paralyzed. So it is actually continuing for one sitting. It can be resist for the 7 months and like that. So it is also nowadays becoming very popular. Next one is the chemical peeling. That is also light peel, medium peel, and deep peel is there. For the light peel, usually some herbal peelings also we are using. Sometimes the lactic acid, sometimes the fruit acid also may apply. But deep peel usually it is sometimes the phenol type of very much carcinogenic materials also sometimes using, the agents also sometimes using, which is causing different complications. So that the complication part I'll tell afterwards. Okay, so this what just applying the solution over the face, just staying for a while, and after just making it normalize and neutralize, then some saline type of solution would be given over the face. It has been seen the most of the heroines and the film stars, they are using the deep peel. Okay, just it is giving the magical changes over the night. So that is very popular, that's why. By the way, microdermabrasion, this is one kind of skin surface resurfacing procedures where actually here I have shown this is actually silicon particles. Okay, so by the using of the air propelling system, these machines actually helping to propelling this entire silicons over the epidermis layers of the skin. That's why any kind of traumatic cases, their scar is occurring, any pimples afterwards, the scar is remaining, everything can be corrected by this microdermabrasion. Now coming to the next one, that is the micro needling. Here actually 0.25 to 2 millimeter, like that. Several types of needles, multiple needles are helping to just removing the upper layer or the upper dermis layer of the skin. Why it is usually using for any kind of scar mass, any hyperpigmentation, hypopigmentations, okay, or any kind of traumatic injuries where the already the upper dermis layer already invaded. Just removing out, we may go for the microneedling procedures. Next one, that is the laser therapy. Yes, we are knowing usually the normal heat, it is actually invading up to the 1 millimeter of the epidermis layer of the skin. But in case of the laser therapy, is having the the capacity to enter up to the 4 millimeter of the layers. Up to the dermis layer also it can invade. So that's why it is very much helpful for any kind of old scar, very much chronic scar mark and all. Not only that, even removing the excess amount of the hairs, facial hairs and all. Even due to its very good invading capacity, it can be used for excess amount of the reductions of the yellow that can be applied. Even for the varicose vein, that also may apply. So this is the actual functions of the laser therapy. Now coming to the thermage. In case of thermage, usually radioactive rays usually using. That's also what this is also causing reading the heat. Okay, and whenever we are doing the collagen fibers, it is also getting synthesized whenever skin is getting little bit heat. So for that, it is penetrating inside the epidermis and dermis layer. So normally it is helping to tightening our skin by the formations of the collagen. In case of the Intel's pulse light, there also the pulse light is using the same thing, same principle also using here. Here also the thermal characteristic, it is also helping to formations of the collagens and tightening our neck portions, sagging portions of our fingers, our hand portions and everything. Okay. Next, coming to the next once again. Yeah. Yes. Now coming to the Ayurvedic aspect on general cosmetology. Yes, actually, the modern science, when they are only emphasized over the external beauty, it has been seen the Ayurvedic science, they have emphasized over the internal and external both beauty, and it has been told that mother in their garbhavastha, the pregnancy time, if they are maintaining their life, their diets, their entire lifestyle properly, then automatic their fetus, they will get all the beauty, all the, I mean, healthy life from there only. That's why it has been told after getting birth also, when the small kids also maintaining the dinacharya and ritucharya by the accessing all the ahara, vihara, rashayana and aushadha, automatic they will enhance their beauty, enhance their appearance. So for that, some points I have just mentioned here, that is daily applications of the kajal actually brightening our eyes, daily just performing the nashya karma actually helping to just restrict the hair falling. Not only that, even dhumpana also restrict our gray hair. Okay, and the cleaning of the feet also increasing our intelligence. So next one is there is having the ritucharya. It has been recommended that in the Grishma Ritu, chandana and some other pearls, gems which should be applied. That is also not applied. We should carry it. That is also increasing our beauty. In Varsha Ritu, garland, the fragrance should be used. The Sharada Ritu, hangshoda, that should be intake. That is also helping to increase our beauty. In the Hemanta Ritu, Abhanga, Shilabhanga is required, and the Bashanta Ritu, Vyama, Ushna Snana, Vika Guru, and Chandana is recommended. Next one is the Garbhavastha. What kind of ahar has been told? It has been told that if the mother, she is taking much more sweets, there is a chances of the obesity in the fetus. Not only that, if the mother is taking much more sour fruits, there is a chances of the pitta prakapa, right? So that is also causing sometimes the kushta. Kushta means not only the leprosy, various kind of skin disorder to the child. Okay, for the salt, excess amount of salt intake, that is also causing the wrinkle. Not only wrinkle, sometimes baldness also occurring. Okay, and it has been told that if the laughing, if mother is laughing so loudly during this pregnancy, and sometimes it also may cause the dark lips to the fetus. Okay, just based on our references. Now coming to some other general aspects, whatever I have told in our science, it has been told that as for the burnio, we are knowing some external applications are there. Burnio means to enhance our complexions. Okay, for that some lepan oil has been recommended. Even that may be made up by the chandana, nakeshara, ushira, padmaka, manjishta, madhuka, sariba, then sitalata, whatever. Even we may intake also. Okay. Next one, in case of the any kind of sugandha drapa, there also rose, kumkum, jasmine also we may use as the dhupana, as alepa and arka. Okay, and for the yogana pirika nashan means any kind of acne, vulgaris and all. For that also bhamana karma raktamokshan with jaluka is very common. Next one, that is the skin. For skin, they are particularly described that for removing the excess hair from the facial hairs, from the bodies and all, we people are using some chemical agents. It's not recommended. We definitely may use the harital, sankha, vinegar. Very nicely it is helping to removing out the excess hairs. Not only that, another composition is there which is not that much visible because we have to make the taila from the lizard. Okay, and then we have to mix up along with the kadali and seeds of ingudi. Okay, so that is also helping to removing the excess hairs. And not only that, even tarpanam, snehanam, shedanam, abhangam, lepanam, virejanam, those are also helping, because we know any snehana, shredana, usually what is occurring? Usually blood circulation getting, I mean, very much fast, and it is helping to, I mean, any kind of impurities are there, that is also getting eradicated, and we are getting flawless beauty, okay, by the doshic, I mean, eliminations and all. And in case of the Virechana also, it is also helping to just eliminate all the doshas which is residing in our koshta. It is helping to eliminating them. Next one is the hair care. For that, so several types of keshya drubba, which is growing, helping to grow up, to grow our hairs and all, and keshuranjaka, coloring materials, even darunaka. Darunaka means the dandruff. the all treatments has been told in our sign. For the Keshiya purpose, their Tila, Bhingaraj, and Nilini, Narikala has been recommended. In case of the Kesharanjaka, their Rita, Amlaki, Shikakai, Hina has been recommended. And next, another one is the Darunaka. For that, the lemon juice card, Amlaki, like that, which means we should go for the treatment of the dandruff and all. So here for Ramo Sanjana means it has been seen some baldness. Okay, not only the baldness, it's some people are having the tendency, any scar mark is there. Natural hair growth also getting, obstructed. In that cases also, Hastidanti Mashi along with Rasanjana can be applied. Not only that, even Kashisha, another formulation I'm telling, that is the Kashisha, Kapitha, Naktamala, that also can be applied. Okay. Next one is the Nasho, Shirodhara, Shirabhanga, definitely. Those are also helping our hair growth. Now coming to the eye care. For eye care, there are different type of house has been mentioned, that is the Chakusha, Mamira, Priyangu, Kataka. Next for the breast growth enhancer, the Mundi Tela, Marichwadi Tela, Shirakarni Tela are very much effective. And sometimes the post pregnancy, their stretch mark usually occurring for the lady. Thus for them, we may go for the Dhataki, Sarsapa, Shirisha and Shira. And for the Mukasandika, betel leaf, Lavanga, Nutmeg, definitely recommended. And the next one is the weight loss. Yes, we are doing the Udvartanam. This is a very good procedures in our science. By the using of the Pottam Chukadi Churnam, usually we are doing this Udvartanam, okay, for the patient. It is also helping to reduce the excess amount of the fat. Not only that, Vamana and Virachana also helping to reduce the fat, along with all the yogasanas like Surya Namaskar, which is also helpful for entire body warm up and for the giving any emphasis the pressure over such areas like abdomen, some hip portions or the thighs portion for that halashana or the hastashana, paschimottanasana. Those are also very much effective and all. Next one coming to the, that is the Ayurvedic aspect on the plastic and cosmetic surgery. What has been told? That is the Dagdha Chikitsa, Sandhana Karma and Anshastra Karma has been recommended, okay, by Acharya Shusruta, by Acharya Bhagbhata and all. Dagdha Chikitsa, whatever the modern science we have already seen there, usually the first degree burn, we go for the Ushna Virya drug and warming body heat and all. Second degree, for that, we usually go for the cold water bath, ghee and poultice and all. But in case of the actually Ati Dagdha, when is already recommended for the flap and all, there we may go for the broken rice, tinduka and ghee. These combinations, just we have to apply over the area, and then by the using of the guruchi or the padma patra, we just sorry, not guruchi, the padma patra, we have to cover up this entire area because it is giving some soothingness and all, okay. So it is actually helping to just healing up this area. Next one is any kind of dagda, we may go for the madhuchishta, murbha, chandana and madhuka. This paste we may apply together. Next one is the sandhana karma. Yes, in our science, the entire plastic surgery related procedures already it's described. That is the nasa sandhana, karna sandhana and ostra sandhana. Sandhana means we are knowing this is actually the rejoining of the mutilated portions, that may be nasha or nose, that may be karna or ear or lips or Chalioplasty or the oremus, okay. So for that, in case of the nasa sandhana, what has been told, I made it some steps here. So in case of the step one, first one leaf we should take, okay, and this leaf we should keep over the nose, okay, where we have to do this rejoining entire the procedures we have to carry it out. So after placing this leaf, then we have to make marking, okay. After making mark, then this leaf again we have to place over the cheek muscle, okay, cheek portions. And after putting there, then just following the marking, okay, then this muscle, cheek muscle would be removing out, okay. And after excision of this cheek muscle, again this muscle as the flap we should keep over the nose areas, and afterwards we have to do the lekhana karma. Lekhana karma to stop the bleeding, okay, stop the oozing of the blood, okay, and afterwards properly the nasa bandhana should be done. As the step 6, better to say the Pashad karma, we have to go for the Tila Taila, Rasanjana, Yashti Madhu, and Patanga. Those things we should apply as a Pashad karma, and for the healing purpose, we should recommend the patient to have the Grita Para. Next one is the Karna Sandhana. Yeah. For that, what first step is we have to hold the patient very tightly along with the attendance and all, and afterwards, Chedda Veddo Aleku should do. Okay, and after doing that, the blood, whatever the blood is, bleeding is occurring, we have to collect and we have to examine it. If it is having the Bata Pradushita, then we have to wash the entire ear along with the Dharna blood. If it is, vitiated by Pitta, then we have to clean along with the milk. Otherwise, Kapha vitiated means we have to clean up along with the Sura. So afterwards, we have to stitch properly, and then again we have to do the Lekhana Karma if there is having again oozing of the blood, just to stop it, okay? And afterwards, as the Pashat Karma, ghee, madhu, and along with pot smart, we have to sprinkle over the areas. Now coming to this is the last one, that is the Anushastra Karma. Yeah, for the Anushastra Karma, we have to, there are having several types of procedures. First one is we are knowing, this is very popular, Raktamakshana. Usually for any acne vulgaris, any kind of DVT, there is having some skarmas, any post-traumatic cases, they are also just removing the skarmas. Also, we may go for the Raktamakshana with Jaluka. Here, it is actually Acharya Shustras we have followed the paste of the sarshapa along with the haridra. We just made this paste and we are just smearing this paste over the jaluka, and afterwards, after keeping one bowl along with the haridra water, we just making them little bit energized, and afterwards we just apply this jaluka over the affected areas. Whenever we are just applying, if it is not getting sucked, that time we are doing the prachana karma also. Whenever little bit blood is oozing out, then easily this jaluka started to sucking out, and afterwards we just cover up by the wet cloth. And then after having the sucking or enter the dushito blood, then we are just removing out this jaluka by the using of sometimes rajani and all or haridra. Then we started to make it vomit. Just a little gently we have to lift it, and after proper vomit, then we have to keep these jalukas again into the separate bottle. Okay, and sorry, after vomiting, then again we are just keeping little bit in the bowl where we are pouring water along with some haridra and all, just making it little bit energized. And afterwards, whenever it is becoming so much active, then we again kept these jalukas to one bottle. And definitely if the bottle should be named by the patient, we should write down properly their name, age, sex and all, and always keep in mind whatever the expenditure and all, we should not use this jaluka never ever to other patient, okay, because of some medical legal issues may occur in future too. Okay, next one, that is the prachana karma. Okay, so prachana karma, for that also it is also becoming very much popular in South India. I have seen there actually the people, especially in the Kerala people, they are doing the prachana over the scalp areas where is having the badness. Okay, so after doing this one, they are using the maricha churna, and their applications of the maricha churna, it is having the tikshna property. It is helping to we know the badness means there is having the kapha prokapa. It is actually restricting the entire growth of the hair. So it is, whenever we are applying the maricha, it is entirely the opposite characteristic of the kapha. So it is helping to again regrowth of the hairs. So it can be also correlated with our microneedling. Same procedures also we may correlate with the prachana karma. Whatever. The next one is the agni karma. Here also the tapta agni shalaka we may apply to any kind of wart, any mole or any kind of corn. Okay. So here also whenever any mole or corn, it is actually disturbing the cosmetic values and all, that time after making it red hot iron, just we are applying this Agni Shalaka surrounding this mole or the wart, and just removing by the using of any artery forceps and all. And afterwards, at the Paschat Karma, we may apply the ghee and honey for their healing purpose. Yes, next Shara Karma. Yeah, for Shara Karma, I did not get any videos, so I have not put yet. I'm just telling myself only. So for the Shara Karma, usually Shara Shalaka is there. In case of any kind of moles, especially any kind of warts, usually we may use the Shara, and it is also helping to. It's also having what you know the Lekhana property, scrapping property. That's why it is very much helpful for any kind of scrapping of the epidermis area and all. So any kind of scars, mark, any kind of moles or any kind of warts, especially the warts is there, means we may usually apply this Shara Karma. Okay, and as the Paschat Karma, the same line ghee also we are applying to heal out. Next one is this is the last one, that is the Baikrita Apaharan. Yes, all procedures we have done already, it has been finished. But afterwards, at the end, what is remaining? Yes, the scar mark. So sometimes to removing the entire scar mark, there's among the 60 upakramas of Brana, there 8 upakramas also entirely described for just making the normalcy, that whatever the Vikriti or Vikriti occurred, just make it normalcy for that, or the restoration of the normalcy procedures had described. What are those? I'm just telling briefly. That is for the Krishni Karma. Krishni Karma means you just imagine one scar already occurred, which is very much whitish in color. So what you have to do, just to make it even with your same complexion, you have to make it a little bit blackish. Then only it will be, it will match with your skin color or complexion. For that, Bhalataka, ash of root of domestic animals we are using. Pandu Karma. Pandu Karma means any scar marks which is very much what you know blackish. So we have to make it Pandu or white. For that, we have to use the milk, rohini fruit, otherwise Vaidala, Sajja, Kasisa, Madhuka, honey and all. For the Rumupaharana, that one I already explained previously, just removing the excess amount of the hairs, what we have to do. So I'm not going to repeat again. For Roma Sanjanana, same thing I have already explained previously. Next one is the Utsadana. Utsadana means the scar marks is there, which is very much what you know depressed. Okay, we have to make it elevated. Then only it will get the same level of the skin. For that, we have to go for the Mangsa and ghee and other trunks. Avasadana, that is, it is very much elevated. So just to make it little bit depressed means then only it will get the same level along with your skin. For that, honey and some powder. Powder, it is actually coarse type of powder. It is actually helping to what you know Lekhana Karma. That's why we are using. Next one is the Mridu Karma. For that, Mridu Karma means the whatever the scar marks is there, it is very much hard, inadequate so much. In that cases, we have to do for the Rakta Mokshana and Bandhana. It will help to softening this induration of the scar. Next one is the Daruna Karma. The whatever the scar mark is there, it is very much what you know soft in nature. We have to make it little bit hard. Then only it will heal properly. For that, bark of Dhava, Dhataki Pushpa, Triphala, Priyango, we are using. Yes, the last part, that is the complications of the cosmetology. Yes, there is having complications, several complications. First of all, we have seen that the chemicals, whatever the chemicals are using for the hair straightening, especially for the chemical peeling, especially for the deep peeling, I told previously, that is the formaldehyde, sometimes phenol are using. Those are exactly very much carcinogenic. Okay, they may cause some lung abscess, some kind of carcinoma in the lungs and all. Okay, not only that, sometimes people dissatisfaction after doing the cosmetic surgery or plastic surgery, people are not becoming so much satisfied. Okay, no, previously what I was nice, now I'm not well, I'm not looking good, like that complaint they made. Okay, not only that, even the scarring, the scar after doing operations, there would be the scar marks, that also would be the another complaining. Okay, another one is the pain and discomfort. Definitely there would be. Not only that, even sometimes implant failure, because it has been seen the people after doing the implantation, it has been recommended they should not go somewhere. They should take, entire bed rest. It has been seen. One incident I'm just telling at the end, that one lady, after doing the breast implantation, or the better to say the breast augmentation, then she just started to fly. Okay, and in the plane, suddenly she started to feel some discomfort. She felt this entire implanted areas becoming larger, and suddenly it totally burst out. Okay, so this incident happened, and then under this lady just expired. So that this is the actual, so many several cases it may happen as the complications of the cosmetology. So precaution is very much important for that. Not only that, even sometimes a nerve damage for the breast augmentations, there is the chances of the suddenly loss of sensation of the areolar areas. There all the nerves are not getting that much, their entire the functions are getting hampered. Not only that, even sometimes the blood loss. It has been seen in case of the abdominoplasty. Their excess amount. This video also people already saw that their excess amount of the hemorrhage, it may cause sometimes death to the patients or some complications. Okay, so that's why those are the complications it may arise. And not only that, another one, that is the anesthetic complication. That is also another problem that we may suffer. So those are the people we are knowing very much. That those are the celebrities who gone through this cosmetic surgery successfully. Okay, but those are the people also you are knowing who became, due to these complications of the surgery, who became from the queen of the heart to the horrible horrible appearance. Okay, so that's why big caution we should take. Okay, now coming to the conclusion. Yes, the matter is, sometimes this cosmetic surgery, plastic surgery, whatever it is, need, because some people who is having the cleft lip or cleft palate and all, for them definitely it is required, it is necessary. Some people, young women, after doing this mastectomy, they should go for the implantations and all. Okay, but in case of part areas fuller or the lip augmentation, just making it plumper, fuller, it is not necessary. It is one kind of luxury. So it is actually the people choice. They will waste their money, or it is necessary or not. Okay, another one, that is the very important thing, that is the malpractice. Yes, some criminal. Okay, some criminal, they are just hiding their appearance, hiding their identity. For that purpose, they are also just uh, doing some plastic surgery. And not only that, even some surgeons, for the sake of the money, they are also helping those criminals just to change their entire contour of the face and all. So this is definitely a shame for the surgeons and our pathy and all, whatever. Now the last word is, whatever I have told, just keep in your mind that is always be cool. Because don't be panicked. Yes, I am getting aged, my wrinkles, my finals lines are now visible. No. Don't think like that, because always keep in mind, external beauty is not lifelong. It will not stay, but your work, your confidence, your whatever your energetic appearance, that is important. What you are doing, your karma, previously I told, your karma is everything. That's why we people are still worshipping whom, APJ Abdul Kalam. If we are running after only the appearance, then never ever this person will just conquer our heart. His work, his knowledge, his wisdom actually conquer our heart. So that's why don't be panic. Okay, and always be cool, and keep smiling and be happy. So those are the references, and শুভ শারদীয়ার আগাম শুভেচ্ছা জানাচ্ছি সকলকে। সবাই ভালো থাকবেন এবং সবাই এনজয় করুন পুজো। এবং definitely thank you so much for listening the entire programs patiently. Thank you so much.
Thank you, Dr. Priyanka. It was a wonderful presentation, and it was like opening a Pandora's box. You have talked about a very important topic, which is quite relevant to today's time, because beauty lies in the beholder, eyes of the beholder. But there are people who are so much obsessed with the beauty and obsessed with the body. They are like, there's a disorder called body dysmorphic disorder, and if they fail to attain the required type of body or body shape or facial angles, they become suicidal or very much depressive. So I think what you have said is absolutely right. So we should not be over obsessed with the concept of beauty. It should lie in the eyes of the beholder. And now the session is open for people who have been queries to Dr. Priyanka. They can ask.
Yes. If
Please,
anybody
anybody
is
having
having
anyone having any queries?
Ma'am, is it possible to lighten the pigmentation of a person who is genetically darker in appearance?
first of all, if the person is having problems, okay, what kind of problem is that? That first we have to sort out. Okay, then we have to give the medicines, not only by the, I mean, just epidermis layer and all. For that we are going for any laser therapy or only just in resurfacing procedures we are performing. No, based on that we have to go for the internal medication. That is also very much important. Okay, and along with that we have to see what kind of any melanoma is there, or any what kind of patients actually you are telling, what is actually, what kind of genetical problem is there. Could you explain?
Ma'am, ma'am, just the complexion. Just the complexion of the some people are
Okay,
darker. So can
okay.
we
Then
increase?
okay, okay. So for that, actually, I can say that we have seen several actresses in our screen that when they are appearing, at first they are a little bit dark, and afterwards, day by day, they are becoming little bit brighter than before. It is actually not the genetical. It is actually presence of the melanoma, excess amount of that melatonin and all. So for that, actually, laser therapy along with the microdermabrasion working fabulous. Not only that, even peeling. And here I want to say one thing, that is, as being Ayurvedic doctor, we should apply the herbal peel, not the chemical. Okay, so herbal peeling also we may apply. Our having the manjishta and all, we are having the haridra, we are having the chandana. So those are also helping. Not only that, any kind of bleach also is helping. So bleaching purpose, we may use our curd, we may use our lemon. That is also helping to just a little bit resurfacing our skin. So definitely it will work. Definitely it will work.
Okay, ma'am. And ma'am, what is your point of view for the stretch marks? There are many patients very much concerned about their stretch marks. So, how can we deal this with Ayurveda?
Yes, for stretch mark, it has been told that is whatever the lines actually forming there, it is actually what you know due to the suddenly what happened. Previously, the adipose tissues were accumulated there. Okay, but after pregnancy, after I mean delivery, usually what happens sometimes this adipose tissues are getting little bit what you melt, and then the fine lines are still remaining. So just whatever there I have told Krishna karma, then another one I have told, that is Pandu karma. So what it has been told, when the stretch mark means there is having white lining. Okay, so then what we have to do, little bit we have to make it little bit dark. If it is becoming dark means then it will get the actual color, just same complexion like our skin. That's why in that cases we may go all the other Barnier drugs, that is whatever the Manjishta and Chandana and all has been told, along with we may go for this Krishna Karma. Krishna Karma will help in case of any kind of stretch mark. Not for the pregnant woman, if any obese person who are becoming lean, for them also it will help. Any other question?
Yes, Dr. Priyanka, you have some more questions, and they have asked you about some recent researches in Ayurveda, which is going on in terms of dermatology.
Again, just I could not understand.
Rajendra Jana has asked you, can you please tell about the researches about the topic in Ayurvedic view?
Yeah, sure.
I guess
Actually,
you've already
what is so?
spoken about it in details, but
Yes,
we are
sure.
not for researchers.
Uh, if we people want to do any research work over the cosmetic, cosmetic procedures and all, by based on the Ayurvedic view, then we may go for the microneedling. There you have, I already shown you the videos. Microneedling, when the modern people are doing the same thing, we may use as the Prachana karma, that I already explained. But whenever we are doing the Prachana karma, that time the another procedures are there, mesotherapy. They are actually injecting the, what you know, the some hormones, some any kind of vitamins along with some micronutrients and all. So our science also having orco preparations. Yes, we are also having bhingoraj. Okay, so those kind of whatever the tissue drugs or herbs we are having, we can make the infiltrated by the distillation apparatus, ARCA preparations. And in the future, we may just introduce these injections over the scalp region for this kind of mesotherapy. This is Ayurvedic mesotherapy. This kind of research work we may do. Okay, another thing definitely that I already told, this Prachana is there. Another one is the peeling. Peeling also there is having some medium, some mild, and some another one is the deep peeling. Deep peeling, if we can introduce this deep peeling type of substance, then we can replace the any hazardness of these chemical agents already, which is causing some kind of carcinoma and all. So this kind of herbs also we may choose, we may use as the scraping purpose and all. So those are the things are there which may go for that. And definitely some diets, that also we may find out some herbs, which is not only herbs, even some fruits, that is also helping for this enter the facial then is inner, just glow, just making it radiant, glorious and all. Based on that, some research work should be done. If we can make it, then only we may increase our whatever the procedures, whatever has been told. Not only that, even the cosmetic surgery, whatever the, especially the rhinoplasty, nasa sandhana, Karna sandhana, Otoplasty, their reference already is there. But the problem is we people are not at all going to do it, because already modern science had established their own system. Okay, but we should tell about it, and we should campaigning about it, that in our science the procedures are there, we should do it. Along with, if there is required, definitely we will take some modern techniques and all. But we have to start. This never ever been started yet, so that is also the backlog, that we have to do it as the research work at the, just a development our science too. Any question more?
Okay, there is one more question, and that is from Dr. Tuhin Kante Vishwas, and he has asked you, can you give some glimpses on Vakrita Paham, aspects of Chikitsa of Shushrut from its cosmetic value?
Okay, from home remedy.
Vakrita Paham,
This
aspects of Chikitsa. Okay.
yes. Okay, Bhakrita Aparana means, I already explained that time, it is actually the restoration of the normalcy. Okay, so after having any scar, after having any cosmetic surgery or plastic surgery and whatever, any procedures, there is the chances of the lift or the remaining of the scar areas. Okay, so for that, just I have seen that in my day-to-day life, usually this madhu, okay, it is fabulous. It is actually, if you are applying this one, that is very good as the home remedy. But Acharya Shushruta, he had explained different kind of, that is Krishna karma. Whenever the, I already explained just that time, that whenever the scar mark, it is becoming so much white, then we have to make it little bit darkened. For that, all the herbs has been already explained there. I already showed. If sir wants to see, then I can again show you. And if you want, I can share you along with that. And not only that, even for the scar mark, which is becoming so much blackish, darkish, for that also Pandu Karma has been explained. Not only that, sometimes scar marks, there the surrounding, the hairs also not getting what developed. For that purpose also, Rumo Shanjanana also explained in the according to Acharya Shusruta for Rumo Harana. Because excess amount, sometimes it has been in the places there, excess amount of the hairs is getting increasing, or the growing is occurring. For that purpose also, we have to go to removing them by the using this entire the yoga already told, the lizard oil and all, and the harital also we may apply along with the kaddali and all. So those are already I have explained. And another thing is there, in case of the vikrita or any vikriti opoharan purpose, they are sometimes having the chances of the uchadana or abhushadana. Uchadana means I already told, the scar already formed, which is very much depressed. So we have to make it little bit elevate, then only it will get the same level of the skin. So for that also we are going for the utsadana karma. Okay, for avasadana karma, it is becoming so much increased or elevated, then we have to make it little bit deeper like that. So then we have to go for the avasadana. So those are the procedures we may do. That is the 8 kind of procedures has been told among all the 60 upakramas, which are very much helpful for restoration of the normalcy or Vakrita Apaharana.
Okay, there's last one. There's one more question from Parvin Sultana. And she
Yeah.
has asked you, ma'am, is there any chance to reappear the excess fat which removed from abdomen or thigh? Because if anyone don't change their food habit, then fat accumulation may occur. So it's a valid question.
So your question is after liposuction. After liposuction, is there any chance
Maybe
to?
she's indicating that liposuction, and after liposuction, is there any possibility that the fat accumulation will be there again if there's no change in
Yes, yes,
lifestyle
yes.
or food habit?
Actually, what after the liposuction, then usually it is recommended to the all patient and all, that you should restrict your food. Okay, there is having some diets, there is having some yoga asanas, or the some physical activities you should maintain. Okay, if the person after liposuction also they are becoming so much so much lazy or lethargic, they are not doing this physical activities properly, again they started to intake much more food, fatty foods and all. So definitely these people, again this fat will be it is a physical activity, physical pathology. Normally pathological matters, okay, not physical, this the pathological matters usually after having the nidana. Definitely the samprapti would be there, again the fat accumulation would be there. That's why it has been recommended that the person, just the example, 110 kgs weight is there, so it is not possible now to reduce that much fat at once. So for that we are recommending better some functional problems also started, like diabetes and diabetes and all, some other problems, some heart issues, and everything has been started yet. So for that cases we are going for the liposuction just to reduce the weight at a glance. Afterwards we are recommending the patient, please you restrict your food properly and your diet, your all activities properly, then only you can maintain. For the maintaining purpose you have to do everything, but if you are cross the borderline, definitely you will accumulate again the fat, like not like the before, but still it will start to increase day by day. So you should be a little bit cautious about the matter.
Okay, I guess we don't have any more questions to ask. So now we have come to an end to the session. And before I
And
wrap it up, I would like to
madam,
thank Dr.
Dr. Ruma madam, Dr. Ruma madam, one announcement for the tomorrow, that should I do now only or afterwards?
Yeah, you can do it now. Before I wrap it up, you can announce No problem.
Okay, so tomorrow also we are having another presentation, but just remember the timing is 8 p.m. instead of 7 p.m. 8 p.m. we are having another presentation by Dr. Subramaniam sir, and the topic is green philosophy. Okay, so I think you people again will come and just now continue, madam.
Okay. So now we have come to an end to this beautiful and enlightening session that has been presented by Dr. Priyanka Ganguly. I must say she hasn't left no topic which should not have been discussed, and she has put her entire effort and time to make this presentation a wonderful one. And I would really like to thank her for presenting it such in a beautiful manner. And besides that, I also like to thank Dr. Tapash Mondal sir, our principal sir, who's without whose endeavor this webinar would have been possible. And I would also like to thank all the people, those who have taken their time to attend this webinar, and also to the students who has been actively participating in this entire webinar session. I would like to thank everyone for being present here and supporting us with their uh, queries and with their desire to know more kind of endeavor. So thank you everyone. And before I wrap it up, I would again like to thank Dr. Priyanka Ganguly. It was a wonderful presentation. Thank you and good night all. Tomorrow we are meeting again at 8 p.m. Thank you.